Hello, this is Dr. Chris Chaplot, the acupuncturist. I'm also an herbalist and an exercise physiologist. And this is my pain series presentation. Actually, this is the second presentation in the series. If you haven't seen the first presentation, it's about a half an hour long. I encourage you to go back and do so. All right, before I start, I want to thank the originator of this series, actually not this particular series, but the information that you're seeing here comes mostly from the Heartstone Herbal School, and it's an online school. And my teacher there, her name was Tammy Sweet, wonderful teacher, and I want to thank her for all of this great information. Okay, let's start. So on the last presentation, I finished with the effects of chronic pain on brain physiology. So let me start there. Okay. What chronic pain does is it decreases the neuroplasticity of the brain. Chronic pain also decreases the gray matter in the prefrontal cortex and the thalamus, aging the brain 20 years. It increases sensitization, that the nerve cells become more responsive to weaker pain signals. It's a self-perpetuating cycle. However, and this is called allodynia, which is when the brain becomes so overactive, so overreactive, it responds to benign input with pain, such as a feather touch feels like a blowtorch. The brain has 100 billion neurons with trillions of connections. And when talking about neuroglia, the neurons are outnumbered by neuroglia 10 to 1. The neuroglia's job is to protect the neurons. It's like the connective tissue or bubble wrap of the nervous system. What is really interesting about these little guys is that they actually have their own communication system. So they communicate just like the nerves that they protect, or I should say the neurons that they protect. Neuroglia contribute to chronic pain. Neuroglia is mostly found in the brain, but can also be found in other parts of the body, but again, mostly in the brain. There's actually 5 types of neuroglia, as you can see by the slide. But what I want to focus on is what's called microglia, which originates from the immune system. Neuroglia in general, they help fight infection, particularly the microglia. They help repair damaged cells. They help protect neurons. And overall, they're crucial to brain function. The other neuroglial cell that I want to mention that's involved with chronic pain is called an astrocyte. Astrocytes, they develop the blood-brain barrier. They are developed from nerve cells. Actually, all 4 of the different types of neuroglia are developed by nerve cells. However, as I mentioned before, the microglia is developed by immune cells. So, how they're involved? Well, when the body feels threatened, like from some type of trauma, physical trauma, chemo trauma, diabetes, nerve damage, inflammation, or blood leaking out of the vessels, they release a chemical substance called alarmins. Alarmins then travel throughout the body and to the brain, where they activate the neuroglial cells. Neuroglia then release cytokine chemicals that can excite the surrounding area in the brain and travel back to the body. So these excitatory cytokine chemicals make everything more sensitive. But not only that, it also speeds up the sensory nerve impulse, or pain signals travel even faster. The pain overall becomes heightened. And how we know this is because they've done studies to prove it. Let me actually move to the next slide. And with morphine, it blocks the receptor that releases substance P. However, when giving morphine to some people, it will actually stimulate the production of these excitatory cytokines and cause more pain. It might shut down substance P, but it activates the neuroglial system, making the nervous system more sensitive and tunes in more to pain. Some people, morphine just doesn't work. And this is one of those reasons. That's why morphine doesn't work so well for inflammation or nociceptive pain. Okay. There are two general categories of interventions. One is called an analgesic, which decreases pain without eliminating any other sensations. And they do it by decreasing substance P, histamine, and prostaglandin transmitters. There are also anti-inflammatories. They can also decrease prostaglandins and kinins. It will also decrease the pressure causing edema. There are herbs that do this, oils, over-the-counter meds, etc. So the first over-the-counter category of medications are called NSAIDs, which is non-steroidal anti-inflammatory drugs. So as its name, they are non-steroidal. They are analgesic and over-the-counter. We've all taken them at some point, some more than others. Ibuprofen, like Motrin and Advil, ibuprofen causes bleeding in the stomach and the gastrointestinal tract. Studies have documented that just one dose, can cause pinprick holes. As you can see from the slide, 100,000 people are admitted into the hospital for GI bleeds from ibuprofen. 7,000 to 10,000 deaths per year for properly prescribed ibuprofen. Another is aspirin, which is salicylic acid, and this is non-steroidal. And then there's another, naproxen or Aleve. All three have shown to increase the risk of heart disease. Their action is to inhibit prostaglandins at the site of injury. See, the problem here is that it shuts down prostaglandins at the tissues, but also systemically, everywhere in the body. That is why it causes GI bleeds. So the mechanism in which the bleeds occur is because the job of prostaglandins is to also create mucus to protect the stomach lining. If prostaglandin production is shut down everywhere systemically, it leaves the gut vulnerable. 18,000 to 80,000 people per year are dying of ulcers, and 2 to 4% of that is coming from the non-prescription, non-steroidal anti-inflammatory drugs. So if you've been immune to ulcers, it can also cause leaky gut, which creates a never-ending cycle, allergies and all types of other issues. If you have leaky gut, which causes pain, therefore you take more NSAIDs, leading to more damage. Again, it's this crazy cycle, unless you know what it does to you. Then there's acetaminophen, which gets lumped into the category of NSAIDs, but it's not. It's not an anti-inflammatory. It's analgesic and antipyretic, meaning that it brings the fevers down. This drug is known as Tylenol. It's also mixed into a lot of other pain medications, opiate-based medications. So, okay, now let's talk these ugly statistics. Again, there's 30,000 people a year that are hospitalized due to acetaminophen-induced liver failure. Again, all of these on this slide work at the level of tissue damage. Oh yeah, and if you mix alcohol with the acetaminophen, it dramatically increases the hepatotoxicity and leads to liver failure. There are herbs that help decrease at the nociceptive level without delivering the damage that the over-the-counter drugs do, such as willow bark, which has all kinds of natural salicylates. So does meadowsweet, especially for healing the tissue and decreasing pain in the gut and the GI system. Then, of course, there's cannabis, which is 20 times stronger than aspirin and 2 times stronger than hydrocortisone. By the way, it's the THC in the cannabis that does the work. These herbs will not work for dysfunctional or neuropathic pain. Again, these work when there's tissue damage or inflammation. Let's move on. Okay, at the level of the nerve, we are on the level of the peripheral nerves. So the nerves that travel the body from the limbs to the central nervous system to the spine and the brain. That's the peripheral nervous system. We have a local anesthetic, which is a reversible block of all local sensation, and that's called Novocaine. I'm sure you've experienced that. Again, you lose all sensation, not just pain. Now, analgesics will just touch the pain. You still experience other sensations. But with this anesthetic, Novocaine, you lose all function of that area, including motor function. Another option is ice at the level of the nerve. Ice slows things down, including the nerves that are sending the pain signal. You can always ice, meaning that you don't have to remember what is needed first, heat or ice. Ice is always something that can be used. Now, it also slows down the process of healing, but it's definitely going to modulate pain. Now, heat, on the other hand, and on the other side of the spectrum, heat also works at the level of the nerve. Heat brings in blood flow to the area. So in the area where there is damage and inflammation, there is all kinds of toxins built up, or the prostaglandins signals. So if you flush the area or dilute the area with more fluid, it will lower the pain and help in the healing process. Also, from an emotional perspective, heat or a hot water bottle is always comforting or makes you happy, and in turn releases endorphins, which are your localized painkiller chemicals of the body. They're the feel-good neurotransmitters. Heat will also increase the firing of the A fiber, which I'll get into in a little bit. Okay, here we are. So this is the nerve level continued. This drawing here is not my drawing. This is another wonderful drawing by Tammy Sweet that I got from her notes. Okay, so here's your spinal cord and a nerve route to the spinal cord. You have 32 sections per side, making a total of 64 sections of nerves that come into the spinal cord. So as you can see here with Tammy's picture, there are 3 tributaries coming into the spine, or rivers, so to speak. The first is the C fiber, and they're the smallest in nerve transmission. So the smaller the fiber, the slower the impulse. C fibers are the slowest, and they carry information about chronic pain. They are 15 times slower than the A delta fiber. The A delta transmits acute pain. Then there's the largest fiber, carries information about proprioception. And what proprioception is, movement and where you are in time and space. Touch, pressure, and temperature. They are myelinated, so therefore the nerve impulse travels very fast. Okay, I'll come back to explain what's happening when we use heat, love, and touch to quell our pain. Let me jump to the next slide to continue with counter irritants. Okay, I'll come back to the previous slide, but first I have to mention counter irritants and rubefactions so that you can see the big picture and mechanism of action. Counter irritants to irritate a little bit, and rubefaction is to make red, provide heat, increase blood flow. The idea is to irritate a little superficially in order to get pain relief deeper. This is how the herb cayenne works, the capsaicin in cayenne. So this is where the A beta fiber, the largest fiber, comes in to save the day. It's here at the fastest speed of conductive nerve fiber that these sensations are felt over the pain sensations that are traveling a little bit slower through the other nerves, through the other fibers, the C and the A delta. The A beta fiber helps cancel the others out because they are experiencing the information coming in through from the counter irritants and the rubefaction from the A fiber, basically flooding this system with warmth or touch and pressure. The A beta fiber takes over, and the other 2 fibers can't transmit as fast or as easily. This is like when you kiss the boo-boo, so to speak. When a child falls and hurts themselves and gets a little bump, the caress of mother's kiss and touch stimulates the A beta therefore physiologically blocking or modulating the pain. Cayenne works here really well, and also cannabis does the job at this level as well. Here's something to consider when using these. Cayenne will burn a little, especially mucous membranes. And if you have like little cuts or abrasions, it can also be a little painful there. So when you use cayenne or some type of uh, gel or paste that has capsaicin in you want to make sure you don't touch your eyes or any other mucous membrane. However, CBD, or even better, full spectrum hemp cannabis, will do the job without you having to worry about touching your mucous membranes. It is a rubefaction, but doesn't have the mucous membrane issue. Okay, continue on the nerve level. Muscle spasms, and pain. This also considers not just the skeletal muscle, but also smooth muscle of the viscera, such as the uterus, intestines, stomach, etc. How we deal with this type of pain, spasm pain, is with the use of antispasmodics. The pharmaceuticals for this are known as muscle relaxants. These meds decrease the amount of neurotransmitters that cause the spasms or contractions of the muscle. Herbal and herbal antispasmodics are kava, valerian, and cramp bark. This is at the level of the muscle where the nerve meets the muscle. Sedatives can also do the job here. The sedatives work in the central nervous system, sedating the entire system, decreasing the excitability of the whole system or the whole body. A common known sedative is alcohol. I'm not recommending someone to do shots. It's just known as a sedative or a depressant. Sedative medications are the benzodiazepines. Herbally, we use hops. That's why the IPA beers are so strong and relaxing. There's other herbs like California poppy, Jamaican dogwood, and again, cannabis, but the THC in cannabis. Lavender essential oil has also been found to be just as effective as the pharmaceutical phenobarbital. It decreases glutamate, which is an excitatory neurotransmitter. Okay, continued with the nerve level. Hyperstimulation. Hyperstimulation analgesia works through the gate control theory of pain. And what we're talking about earlier in slide 23, let's see, slide 23. Yeah. How the sensation that comes through the A beta nerve washes out or modulates the pain sensation coming up through the other nerves. Again, one way to manage the pain is to flood the system with touch and heat. The other is with electricity or the use of a TENS unit. It works on the same premise to flood that A beta nerve to wash out the pain coming from the other nerves. It also releases the body's natural opiates, endorphins, and enkephalins. Touch in the form of massage releases these chemicals as well. Acupuncture is another fantastic therapy that works through this mechanism and others. Okay, thank you. That actually takes care of my presentation, but I have another one coming, so please stay tuned and we'll be with you soon. I'm hoping within a month. All right. Thanks again. And thank you um, to my teacher at the Heartstone Center for Earth and Essentials. Thanks, everybody. Bye bye.